Dr. Ketan Pandit Pautra, practicing infertility specialist and gynecologist since almost 29 years. I have been associated with Embryon Mumbai since 2017. There are many myths revolving the techniques used during IVF. One of them is, if a frozen embryo is used, achieving a viable pregnancy becomes more difficult. Well, the fact is, achieving a successful pregnancy is in fact more likely, if not the same, when a frozen embryo is used than transferring the fresh embryo. There are many factors because of this, because it places the woman in a better condition, and also the embryo has already shown its potential to survive, and we've been finding good results with frozen embryo transfers. So there's a myth that frozen embryos cannot be stored for extended periods of time. But the fact is, now with so much advancement in the techniques of freezing, thawing and storage of embryos, the embryos can be stored for an indefinite period of time. Though the standard protocol is to store embryos up to 10 years, but even for longer period of time, the embryos can retain their viability and the cell integrity is very well maintained. There have been incidences where embryos have been transferred after 50-60 years and still achieved normal, healthy, viable pregnancies. Okay, there's another myth that frozen embryos are of poor quality. So in fact, before an embryo is frozen, it has already grown for a few days, and only the best quality embryos are in fact selected for storage. So the process of freezing embryos is completely safe and effective, and babies born from frozen embryos are no different than babies who are born naturally. So there's a misconception that you have no control over what happens to your embryos. Well, in fact, there is a very well-defined system, a proper consent which is taken before embryo freezing regarding with all explanation as to how long the embryos will be stored, what happens in case the couple gets incapacitated for some reason, whether they would want to use their own embryos again for future pregnancies, whether they would want to give up the rights on the embryos and allow it to be used for other couples who are desirous of pregnancy, or would want to permit the use of those embryos for research, as well as there are various other options available for them, and the process is absolutely thorough and transparent.